Hi, my name is Karen Loss. A couple of weeks ago, I gave a talk over the National Press Club as a lung cancer patient advocate. Here's what I said. 4 years ago, the day before Thanksgiving, I underwent the CT-guided needle biopsy that would change the trajectory of my life. Like so many other lung cancer patients, neither my doctors nor I were looking for or expecting a lung cancer diagnosis. After all, I never smoked. I was healthy and active, and there was no history of cancer in my family. Well, lung cancer anyway. After 2 years of not doing tests that would find the cause of my recurring chest attacks, very possibly because I didn't have the one bit of personal history that screams lung cancer, my gastroenterologist finally sent me for that CT scan. Even when I researched the possible results online and found a 40% chance that it might be lung cancer, I still felt confident that this wouldn't be the outcome. After all, I didn't smoke, never had, and well, smokers get lung cancer, and they do bring it on themselves, right? So I shared the Thanksgiving holiday with my family and returned home to fulfill a biopsy appointment. Just a few days later, sitting in my office at work, I answered the fateful phone call. Yes, it turned out I did have lung cancer, and it appeared to have metastasized to my liver. I asked for a referral to an oncologist and got in the next morning. After an initial consultation, a brain MRI, a bone scan, and EGFR and ALK testing, my new doctor and I determined that I would need to get underway with chemotherapy. From that point on, I began a crash course in non-small cell lung cancer. I not only learned about the treatments I was receiving, their side effects and expected outcomes, but also what might lie ahead. I read lots of articles and asked lots of questions. My doctor quickly found that I was a patient who would not sit idly by and wait to die. Not me. While I did some serious chemo and maintenance therapy, then more chemo, I kept on learning. I realized, as every lung cancer patient quickly does, that we all become stigmatized the moment we receive our diagnosis. Even people who knew me wondered if I had smoked somewhere along the line. This drove home to me the lack of awareness and understanding people have about this disease. One friend, an intelligent woman, even assured me that smokers do indeed cause their own problems with this disease, and that because of that, no, they don't deserve the same compassion and consideration others deserve. Why should they? After I picked my mouth up off the floor, I just thought, wow. I'm a believer that even bad circumstances can be used for good outcomes, and I began looking for lung cancer activities to get involved in. First, I looked for fundraising opportunities and found Longevity's Hope Summit and the American Lung Association's Fight for Air Climb. It wasn't long before I was fielding fundraising teams and speaking out as a patient advocate to groups large and small. I published my journal of letters that shared firsthand what I'd gone through in the first 9 months of my lung cancer journey. And one of the things I did was to create a Facebook page that quickly morphed into what I now call a lung cancer clearinghouse for lay people. I work hard to keep it updated with current news and happenings in the lung cancer community. This, in turn, has forced me to stay on top of the new treatments and therapies coming out. More in the last year and a half than in the previous 10 years, in fact. When so many of my friends were diagnosed with lung cancer, they were given very short-term prognoses and little hope. Thankfully, many of them remain with us years after their initial diagnoses, even with metastatic disease. This simply was not the case for our predecessors even a few years ago. Now, we know that newly diagnosed patients can and must receive genetic mutation testing immediately. A few short years ago, there were only 2 or 3 mutations that could be treated with targeted therapies. But now, there are at least 9 or 10 that fall into this category. There will surely be more and more in the years ahead. Now when we talk to our oncologists, even if a treatment we are on is no longer working, we can look to many other options and clinical trials that are available. Where there used to be little hope, we have reason to reach to the future. I hear some people say that only a minority of patients are helped by the widely publicized immunotherapy drugs, and while they might be right in some ways, that minority is still significantly larger and is responding significantly better than had happened in previous patient populations with many fewer and much harsher options. Now, researchers are working hard to find out how to better individualize therapy, to find the patients who have exactly the right genetic makeup for just the right drug or drug combination. From a patient perspective, I think most of us will be thrilled when the day that chemotherapy and its attendant side effects will be less of a mainstay in our care, because you know what? Quality of life does matter. We know that for now, most people diagnosed with lung cancer do have a terminal disease. But when the treatments make us so sick that we'd rather die than live, well, let's just say that can be quite a challenge. Thankfully, though, researchers are working hard to change that for all of us. What I've seen in my nearly 4 years of living with stage 4 lung cancer is that due to new treatments, targeted therapies, and immunotherapies, more and more of us are living with lung cancer as a chronic condition rather than succumbing to it in mere months. These tumors that live within my liver and lung are just hanging out in my body. And as long as that's the way they stay, well, you know what? I can live with that.